muscle attachments of the ilium. This muscle attachment you have to start from the ilium attachment. This is the one which is the anterior superior iliac spine. This gives origin to the sartorius muscle and lateral end of the inguinal ligament. Anterior inferior iliac spine gives origin to the, we are going to get the straight head of rectus femoris muscle and iliofemoral ligament. Posterior inferior iliac spine gives origin to the piriformis muscle. So iliac fossa, this iliac fossa gives origin to the iliacus muscle. Then going to the gluteal surface, this gluteal surface of the ilium is divided by the three gluteal line. This is the anterior gluteal line, posterior gluteal line, inferior gluteal line. The area behind the posterior gluteal line gives origin to the gluteus maximus muscle. Area between the anterior and posterior gluteal line gives origin to the gluteus medius muscle. Area between the anterior and inferior, that is a gluteus minimus muscle. And below the inferior gluteal line grew above the acetabulum, that is we are going to get the reflected head of rectus femoris muscle. That is all these are the muscle attachments of the ilium. Going to the iliac crest, this is the iliac crest. This is a tubercle of iliac crest and iliac tuberosity. This is the iliac tuberosity and this is the tubercle of iliac crest. So this iliac crest muscle attachment we are going to deal. This muscle attachment of the iliac crest divided into a from the anterior 2/3, that is a ventral segment, and this is a posterior 1/3 dorsal segment. This anterior 2/3 ventral segment is divided into a outer lip, intermediate area and inner lip. So three lips we are going to get in the that is the anterior 2/3, that is the ventral segment of the iliac crest. Dorsal segment 1/3, it has a outer slope it is going to get and inner slope we are going to get. So what are the attachments of the iliac crest? On the outer lip. Outer lip gives attachment to the following muscle attachment. You have to remember the fascia lata in its whole extent. It gives the attachment of the total fascia lata in its whole extent on the anterior 2/3 of the outer lip of the iliac crest. Then insertion of the external oblique on the anterior 2/3 and tensor fascia lata in front of the tubercle attachment, there is a origin. Then we have the latissimus dorsi on the posterior part, that is the origin on the outer lip of the iliac crest. Outer lip of the iliac crest gives fascia lata, tensor fascia lata, insertion of external oblique and latissimus dorsi. Going to the next point, that the intermediate area gives origin to the internal oblique muscle. Then inner lip, which is we are going to get, inner lip provides attachment to the anterior 2/3, it gives attachment to the transversus abdominis muscle, transversus abdominis muscle. And deeper to that, we are going to get the attachment of fascia transversalis and fascia iliaca. And posterior most, we are going to get the, we have the thoracolumbar fascia surrounded by the quadratus lumborum. Quadratus lumborum surrounded by thoracolumbar fascia. These all are the attachment of the anterior 2/3 of the iliac crest attachment. Then going to the outer slope, which is we have outer slope on the dorsal segment gives origin to the gluteus maximus. Inner one gives attachment to the erector spinae muscle. That is all about the, this is all about the muscle attachment of the ilium and iliac crest. Then going to the muscle attachment of the pubis. Here pubis muscle attachment, this is the body of pubis. Here we have the pubic tubercle provides attachment to the pubic tubercle provides attachment to the medial end of the inguinal ligament. Lateral end is attached to the anterior superior iliac spine. Medial end is attached to the pubic tubercle. And this is the pubic crest. This pubic crest is crossed by the ascending loop of cremaster muscle. That is we are going to get. Then anterior surface of the pubis, which is gives attachment to the one which is we are going to get the rectus abdominis muscle. Below that we are going to get the pyramidalis muscle takes origin. And on the anterior aspect we also get the origin of adductor longus muscle. Rectus abdominis, pyramidalis, adductor longus, they are originating from the anterior surface of the body of the pubis. Then inferior ramus, it is going to the give the attachment to the origin of gracilis muscle on the inferior ramus of the pubis. Then deeper to that, we are going to get the adductor. This inferior ramus of the pubis gives attachment to the gracilis muscle. On the inferiorly, we are going to get the gracilis muscle, and lateral to that, we are going to get the adductor long. That is, we are going to get the brevis muscle. So these are the muscle attachment and obturator externus along the margin of the obturator foramen. This is the one which is attachment of the gracilis and adductor brevis and obturator externus along the both the rami we are going to get in the attachment of the pubis. This is the one which is we are going to get the pelvic surface of the pubis, gives attachment to the anterior fibers of levator ani muscle and obturator internus muscle. So these are the pectineal surface of the pubis, gives origin to the pectineus muscle. So this is all about the muscle attachment of the pubis. Then going to the next muscle attachment of the ischium. This muscle attachment of the ischium, which is we are going to deal. This is a ischial tuberosity muscle attachments we are going to. This is the body of ischium. This is a ischial tuberosity. This is divided by the oblique ridge into upper area, lower area. This upper area is subdivided by a oblique ridge into a superior lateral and superior medial area, and lower area is longitudinal, divided by longitudinal ridge into a inferior lateral and inferior medial area. The superior lateral area gives origin to the semimembranosus muscle, and superior medial area gives origin to the semitendinosus muscle and long head of biceps femoris muscle. Inferior lateral area gives origin to the, we are going to get the adductor magnus muscle. Then going to the ischial spine, this is the ischial spine which is there. Along the margin of the ischial spine gives attachment to the sacrospinous ligament. On the pelvic part of the ischial spine, upper margin gives origin to the coccygeus and lower margin gives attachment to the levator ani muscle. So these are the attachments of the sacrospinous ligament, coccygeus and levator ani, attachments of the ischial spine. This is a lesser sciatic notch. Upper margin gives attachment to the superior gemellus, lower margin gives attachment to the inferior gemellus muscle. Then going to the femoral surface of the ischium, the upper part of the lateral border of the ischial tuberosity gives origin to the quadratus femoris muscle. Then we are going to get inferior part, which is we have come across the adductor magnus attachment, origin of the adductor magnus and obturator externus. So femoral surface of the ischium gives origin to the obturator externus, quadratus femoris, then we are going to get the adductor magnus. This is all about the, we are going to get in the femoral surface of the ischium. Then we have the pelvic surface of the ischium, gives attachment to the obturator internus. That is the one you have to remember. Next comes about the conjoint ischiopubic ramus. This conjoint ischiopubic ramus which is there, this is gives attachment to the gracilis, adductor brevis, chiefly from the pubic ramus, and adductor magnus chiefly from the ischial ramus. Then also we have the obturator externus chiefly from the pubis and ischium, both the ramus, that is the attachment. And the inner surface of the that is a conjoint ischiopubic ramus gives attachment to the, we are going to get the obturator internus, superficial and deep perineal muscle and sphincter urethrae muscle. In the upper part, obturator internus, then sphincter urethrae, superficial and deep perineal muscle are attached with the inner surface of the conjoint ischiopubic ramus. So this is all about the muscle attachment of the ilium, iliac crest. Then we have studied the, that is a pubis muscle attachment and ischium. You have to remember insertions are two only. External oblique muscle inserting on the outer lip of the iliac crest, that is a one insertion, and the psoas minor muscle on the above the iliopubic eminence. These are the only two muscles taking insertion in the hip bone. Otherwise almost all the muscle they are going to take the origin from the hip bone. And this is all about the remembering. Acetabulum has the larger cavity in between the ilium, pubis, ischium, above the obturator foramen. This has a lunate surface, that is the articular surface, anterior, superior and posteriorly. This is how we call as a acetabular notch and acetabular fossa. Acetabular fossa. So this is the one which is you have to remember, and this is acetabulum articulating with the head of femur, articulates and forming the hip joint. So acetabular notch, acetabular fossa, lunate surface, that all will be the, you have to remember about the acetabulum. So this is what about the, you have to remember about the acetabulum. Obturator foramen, it is large and oval in males and small and triangular in females. So that is the one you have to remember. And this is situated below the acetabulum, in between the pubis and ischium, that is the obturator foramen. And this is closed by the obturator membrane. Hip bone ossifies in cartilage, and this hip bone is ossifies in cartilage, that is 3 primary and 5 or more secondary center. 3 primary, one for the pubis, one for ilium, one for pubis, one for ischium, and 5 or more secondary center, Y-shaped cartilage 2, iliac crest 2, and ischial tuberosity, that is a 1. So these are the 5 secondary center, 3 primary center. Conjoined ischiopubic ramus forming 7 to 8 years of life. Then as the acetabulum, 18 to 20 year ossification completes. Whole the hip bone ossifies completion is at the age of 22 years of life. This is all about the introduction, site determination, anatomical position, general features, muscle attachments of ilium, iliac crest, pubis and ischium. More detail about acetabulum, obturator foramen, and I have told lastly the ossification of the